The White House is demanding more transparency following the release of the World Health Organization's report into the origins of COVID-19. The report issued this week suggests the pandemic likely started with transmission from one animal to another and then to humans. But the report falls short of signaling the lab in the Chinese city of Wuhan, where the virus was first detected, as a potential source. WHO investigators have said that more research is needed to determine that, but the Biden administration says Americans deserve better information. The U.S. has now joined more than a dozen countries calling for the independent and fully transparent investigation. So joining me now is David Feith. He is an adjunct senior fellow at the Center for a New American Security, and he was also former Deputy Assistant Secretary of State for East Asian and Pacific Affairs. Thank you so much for joining us. So in the statement, world leaders also criticized China for failing to provide WHO investigators with sufficient data. What did their research rely on then to determine where the virus originated from?
Well, unfortunately, the research that went into the report this week was not what can be fairly called scientific or forensic or investigative research. It relied basically on very strict parameters set by the Chinese authorities. This was not an independent report by the World Health Organization or by international investigators. It was a joint report done by some international investigators convened by the World Health Organization and Chinese scientists, who of course are subject to the control of the Chinese authorities. And so the Chinese authorities set very limiting parameters, and this report had to stay in them, making it a highly politicized and not scientific document, so much so even that Dr. Tedros, the director of the World Health Organization, joined the Biden administration and many other countries in criticizing it and saying that a lot more inquiry into what really happened with the outbreak of COVID-19 is still needed.
Well, on Tuesday, the leader of the team behind that WHO study addressed some concerns about the lab leak theory and why it wasn't the main focus of their investigation. Let me play some of that.
Nobody has been able to pick up any firm arguments or proof or evidence that these labs or any of these labs would have been involved in a lab leak accident. So of course it's possible, and therefore it's also part of the conclusions in the report that it's not impossible that could have happened. But we haven't seen or been able to hear or see or look at anything that would warrant different conclusions from our side.
So, David, you worked for the State Department in January when it issued a statement confirming that researchers at the Wuhan lab in autumn 2019 became sick, showing symptoms similar to those of COVID. Where was this information in the report? Did investigators interview the researchers who became sick?
Basically not. And this is one of the most troubling aspects of what is going on here, which is that the U.S. State Department, as you noted, released in January information about how the U.S. government has reason to believe that several researchers inside the Wuhan laboratories were sick with symptoms consistent with COVID-19 or with other common seasonal illnesses at the very moment just before the public outbreak of COVID-19 in Wuhan. This is exactly the scenario that you would expect to see if indeed COVID-19 had its origin in an accidental laboratory leak. The Biden administration has confirmed those facts. They aren't in dispute. And in fact, even two of the World Health Organization researchers have confirmed that there were illnesses. The trouble is that the World Health Organization joint report with China that just came out this week didn't actually investigate this matter at all. They didn't provide us with names and information on the researchers. They didn't provide us with insight into the researchers' medical condition from the fall of 2019 before the public outbreak. They didn't interview family members or others to see whether there was a chain of transmission indeed from this cluster of suspicious illnesses. All they did was they took the word of the Wuhan laboratory itself and of Chinese authorities that these researchers were never sick with COVID-19. And that is obviously completely inadequate. That's not a scientific or forensic investigation. And it's part of why so many scientists and now governments are speaking up and calling for a much more serious investigation, because getting to the bottom of this is hugely important for not only understanding the catastrophe that we've been living through, but especially for understanding how to prevent the recurrence of a next pandemic that could come again soon. It could even come in a more catastrophic and deadly fashion.
So, David, just quickly, how do we know about this cluster at the Wuhan lab? Where was that sort of initial reporting? How did that come to light?
Well, as the statement that came out of the State Department on January 15th said, this is based on U.S. government information. This information comes from a range of sources. The U.S. statement that was released in January was a careful product worked across the U.S. government so that we were able to release certain facts that we knew to be true and that we believe underscore the need for a thorough and credible investigation. But of course, there are also limits often on how much information the U.S. government can reveal about how it knows what it knows. I would note, though, that there have been many in the press, many in the Congress and others who have encouraged the Biden administration to try to release more information underlying the statement that came out of the State Department in January. I think that would be a good thing, partly to help answer questions like yours. But again, this information that we released in January and that the Biden administration has confirmed has also been confirmed by the World Health Organization investigators. It's just been effectively simultaneously dismissed by them. They've said things like, oh, well, it was flu season. In other words, the illnesses must have been the flu. The problem is they've offered no proof that it was the flu. And we all have a great need and interest in knowing whether it was the flu or whether indeed this was an early COVID cluster and more likely even the original COVID cluster. This is important because there is no animal, there's no bat or pangolin, there's no wildlife market anywhere that is as plausible a case of patient zero for COVID-19 as these sick researchers inside the laboratory. It could have indeed come from a natural origin, but this is the most important lead we have, and we really need to chase it down.
So, in your opinion piece for the Washington Post, you highlight one WHO investigator and his link to a Dutch lab that caused some controversy several years ago over a risky virology experiment. Why did you put that in the piece? Why is that important?
It's important because one of the problems with the report that has come out this week from the World Health Organization in China is that several of the international investigators convened by the World Health Organization have very obvious conflicts of interest. So not only was this report heavily influenced and shaped and constrained by what the Chinese government wanted, but even the ostensibly independent international researchers are themselves very conflicted. One of them, as you've mentioned, Dr. Marianne Koopmans, comes from a Dutch laboratory that has actually been at the center of the very kind of scientific research that is dangerous scientific research that seeks to work on pandemic prevention by creating vaccines and therapies. But it does this by systematically collecting dangerous pathogens and working with them in the laboratory to make them even more infectious for humans to see if we can then create therapies to combat them. The problem with this research is that obviously it creates in laboratory conditions extremely dangerous viruses that don't necessarily exist in nature. And these laboratories can have accidents and leaks. This happens fairly frequently, not only in China, but it has happened several times in China. The fear is that this is what happened in the origin of COVID-19. And so to have researchers in the study who would have intense personal and professional ramifications if indeed the evidence pointed to a laboratory origin is a conflict. These scientists have real expertise, but they don't have conflict-free, unbiased and independent standing. They instead have an enormous stake in pointing to some mysterious and unspecified animal origin for which there's not yet any evidence, and pointing away from this laboratory because the laboratory in Wuhan was specializing in exactly the same kind of dangerous scientific research that goes on also in the lab in the Netherlands, and that has been the subject of scientific concern, and I should say also Obama administration concern for more than 10 years. This is the kind of dangerous circumstance that we might have seen cause this outbreak in Wuhan. We do not know that yet, but the pursuit of that question is extremely important, and it would be better, of course, for the question to be pursued by investigators who do not have intense personal conflicts of interest.
Boy, David, you have really given us a lot to think about. We could talk to you for a good long time. Thank you so much. You're raising really important questions. Experts have warned that, COVID-19 may not be the first pandemic that we see, that this may be part of a trend. So really appreciate you spending time with us today.
Thanks. Glad to be here.